letter where it shouldn't go, that's also grounds for refusal. So one example that a company had was that they said, this product supports connective tissue. That was what it said in the PCI. They submitted, this product supports connective tissues. They added an S. It was turned down. So, I mean, this is the type of bureaucratic ridiculousness that they're dealing with. Basically, what NHPD, the Natural Health Protection Branch's mandate seems to be, turn down as many products as you can. Actual statistics, it's been 6 years since 2004 that they set up the Directorate to issue natural health products to natural products. 2004. In that time, there's been over 57,000 applications and exactly 25,900 products have received approval. That's about 40%, okay? That means that 60% of natural health products, I thought maybe we were getting the fly-by jets, approaching us, supporting us. That means 60% of natural health products are what we stand to be losing. 60% of products that have been proven safe, many of them used for thousands of years, all of them used for hundreds of years, and these are being taken away. I think most of you can figure out why they're being taken away. I think most of you can figure out what is behind this. And what Canada has to lose is huge. It's huge. Just some of the things besides limiting access to products and taking away our freedom of choice. This is removing the ability of companies to make any kind of unique formulations. Because to get a single herb like parsley approved, that might take 2 months of work. To get a herb that might be a combination of herbals, say some traditional Chinese herb formulas have 12 ingredients in them, this could take up to 6 months of work for scientists and people to put together. The number of forms, I mean, I think some of you have ideas of government bureaucracy, but I have a list of forms that need to be done to get a product passed. It is mind-boggling. Each form would take about 2 days for somebody who's knowledgeable in the business to fill out. I mean, the forms, there's product license applications, contaminant calculations, non-medicinal ingredient forms, additive combination forms, quality summary reports. It goes on and on and on. Evidence of safety report, adverse reactions, risk information. It goes on and on and on. And the studies that they want are double-blind clinical human trials, which cannot be done on natural products. So what they're doing is giving us the regulations that are suited to drug trials. They're not giving regulations that are suited to natural health products. The studies, if we are able to find a study that supports a natural health product, guess what the NHPD says? Oh, we don't accept it. And they will rip it apart. They will find if it's a wording, if it's a typo, they'll just rip it apart. They'll say that study isn't a group that we accept. So they haven't made any kind of clarifications of what is considered an acceptable study. So when a company might spend 6 months putting together a study, then they just return it, they refuse it. So we are losing any competitive edge in the natural health markets. There's a huge economic impact. Vi referred to some of this. Now the economic impact just isn't in the loss of jobs and loss of research in natural health products. Times Colonist, which I really wish would be here, had an article in the 2009 newspaper that the cost of pharmaceutical drugs in Canada were $30 billion per year. That was in 2009. Now, plant yourself firmly so you don't get blown over. You'll be blown over by this fact. That means $1,000 for every man, woman, and child in Canada being spent on prescription drugs. That was 2 years ago. That's probably gone up. So I don't know about you, but I'm certainly not spending $1,000 a year on prescription drugs, and I doubt that most of you are here. So if you look at the economic cost of what that's costing our healthcare system, what possible logic is there in a sane person's mind to increase those costs and take away natural products that you are willing to pay for yourself. It just doesn't make sense. So this is creating horrible costs on our already overtaxed system, and it's primarily taking away choice. So we please encourage you, sign the paper that shows you were here, that will send in those demands to the government. The other things we've asked you to sign is, one is called a Freedom of Health Charter petition. There's presently close to 65,000 signatures across Canada that have been collected for this. We're aiming for 3 million. This is a long-term initiative to get the Health Charter of Canada going. There's another petition that I've also brought, and it's called the CETA, Canada's EU CETA Commission. It's another trade agreement that our government is working on that I doubt anybody's heard about, where they're looking to harmonize our trade with Europe. Some people here mentioned they know about the European Codex Commission. That's the commission that has regulated, for example, in Germany, they can't get vitamin C in quantities greater than 25 milligrams without a prescription. Do we want Europe regulating what Canadians want? No. So I encourage you to sign that petition as well, the one that says CETA. I'm going to open the mic right now because I know some people need to get going. They're probably freezing to death. But I'd like some people to come up and tell us, why do you want natural health products? Just quickly, I mean, if you've got a story about, like Vi's, how she's been helped by natural health products when she wasn't, why you believe that that's your right to have a natural health product. Anyone come on up and just quickly pass it on. Let's see what